Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Excess belly fat poses higher health risks for some women who are of normal weight.
That's right. A new study adds to the evidence that belly fat is dangerous.
Researchers at the University of Iowa who studied more than 150,000 women say postmenopausal women of normal weight are at increased risk of death from heart disease and cancer if they have excess abdominal fat.
Here to discuss is a Mayo Clinic endocrinologist at Mayo Clinic's Menopause and Women's Sexual Health Clinic, Dr. Ekta Kapoor. Welcome back to the program, Dr. Kapoor.
Pleasure to be here. Thank you.
Thanks for being here, Dr. Kapoor. So where you carry your excess weight is more important than how much you weigh?
Potentially.
So is this for all women or just postmenopausal women?
This is, as a matter of fact, true for men and women alike. So it's very well established that central body fat has adverse metabolic consequences, meaning increased risk of high blood pressure, diabetes, heart disease. But it is a more acute and pronounced issue for postmenopausal women because postmenopausal woman at the same so-called body mass index compared to one who's premenopausal is more likely to have central body fat because she loses muscle mass after menopause. So she's more at risk for having central body fat after menopause.
Is central body fat a more medical way of saying a pot belly?
Kind of.
I think that in America we call it a pot belly because then that makes it cuter. I don't understand it.
Yeah, I don't know if there's anything cute about it, but it's so-called the apple distribution of body fat compared to pears who tend to carry more of their body fat in their lower half of the body.
And that is not as dangerous if you have fat in your thighs, for example.
Having excess body fat is dangerous, period, but lower body fat is more protective in the sense that it confers a much lower risk to perhaps even a negligible risk of having things like high blood pressure and diabetes.
So being overweight, whether you're a man or you're a woman or whether you're postmenopausal, does increase your risk for death from several different diseases.
It does, but then again, it's very important as to where that excess body fat is. If you look at the results from this study alone, people who were overweight or obese, and if they are women and they did not have central obesity, they were in fact not at increased risk of dying. Their risk of dying was even lower than women with normal weight and no central obesity. So I think it is becoming more and more clear that where you carry your body fat is kind of the most important parameter to consider.
How many women are we talking?
So this is a large study with a long follow-up. So 156,000 women who were initially enrolled in the Women's Health Initiative, the so-called WHI study. They were followed for a period of about 20 years. And then they classified women as having normal weight, being overweight, and being obese based on BMI, body mass index criteria. And then they subclassified these women as those having no central body fat or having central body fat defined by waist circumference greater than 88 centimeters. So that's how they did it. And what they found is that women who were even of normal weight, if they had central obesity defined by the waist circumference criterion, their risk of dying, and I pause a little because that's a very important finding, their risk of dying is comparable or was comparable to women who were obese and had central obesity.
All right, how do you explain this?
So how do we explain this? Yes, what it goes to say is that if, let's say, you have two individuals at the same body mass index, one that has more central body fat is more likely to have all the adverse metabolic consequences that I keep talking about, high blood pressure, diabetes, and risk of dying. And the way to look at it is that if somebody is of a normal body weight, but they still have central body fat, what that tells you is that most of their weight, or a large proportion of their weight, is going towards the central body fat. In other words, they probably have low muscle mass. They probably have lower fat in the lower half of the body, which both of those are actually protective. Because the way I explain to patients, people who have high muscle mass, muscle is in a sense a powerhouse of the body. It is where a lot of calories are burnt at rest, and a lot of calories are obviously burnt when you're exercising. So if you have lower muscle mass, you just burn fewer calories, period. Similarly, if you have lower amount of fat in the lower half of your body, you don't have those protective effects. If I were to explain it to you this way, lower half of your body is a very efficient fat depot. it does not release the toxic fatty acids into your bloodstream, which the abdominal fat does. And that we think is a risk factor for cardiovascular disease.
One of the things that I read, and it may have been a quote from you, and it was, where we carry our fat determines our metabolic health. Is that kind of what you just explained?
Exactly.
For men and women?
For men and women. The reason why we make a big deal in postmenopausal women is that, before menopause, if a woman gains weight, the predisposition is for that fat to go into the lower half of the body under the influence of the hormone estrogen. After menopause, as the estrogen levels go down, we lose that protective effect, and majority of the fat goes to the belly area. So I have women in my office who really haven't a change in weight as they've gone through menopause, but they see more belly fat. And the reason there is, they're unfortunately losing muscle mass, but gaining fat here. So their overall body weight or BMI is not really changing, but they are still getting more central body fat. And that's what increases their risk of diabetes, high blood pressure, heart disease.
So do you think it should become standard practice for physicians to measure to do a waist measurement?
Absolutely.
And you said 88 centimeters. Can you put that into inches?
35.
35 inches. So anything below that you think is probably okay. Anything above that is potentially a problem.
So we were just talking in our clinic yesterday that, in our menopause clinic, we universally measure the waist circumference, but how often are we actually paying attention to it? And if a person has a normal BMI, we don't really look beyond that, which we feel like as a medical community that needs to change. That BMI is not an ideal marker for assessment of body fat stores, not at all, because it tells you nothing about body fat distribution.
What if I were to tell you that everyone in my family, men and women, have got the same pot belly, including the thin people, the heavy people? Everybody has the same pot belly. So is there family history here?
Genetics do play a role in where you carry your body fat. So a lot of the things play into it. You're exactly right. Genetics play into it. Hormonal influences, like I shared with you, estrogen in your body. Then, if you get obese, after a point, most of that fat is going to go in the central distribution. So how much total body fat you have, how you exercise, all of these factors determine where the body fat is distributed.
And we should remind our audience that the easiest way to figure out what your BMI is just go on the internet, put in your height and weight, and it will tell you. But you're also saying that BMI doesn't matter all that much. It's body fat. It's central body fat.
Exactly. And for lay people, I'd also say, a highly muscular man out there may have an elevated BMI by standard measurement, but is that necessarily a bad thing?
All right. Now, how can women avoid this problem or solve this problem, especially postmenopausal women?
And that's $1 million question, and one that comes up in the clinic all the time. Unfortunately, there is no magic solution to it. What I tell my patients is that the rules of the game and the game of weight maintenance and weight loss are just different as we get older. It calls for even better attention to your lifestyle choices, so dietary discretion and maintaining your physical activity, or perhaps even taking to the next notch. The one unique thing about postmenopausal women that I tell them is that to maintain their muscle mass, resistance training, because traditionally the focus used to just be on aerobic training, aerobic exercise, but resistance training is equally, if not more important for postmenopausal women for the purpose of muscle building.
A few weights. And that's what you and our producer are doing, right?
We're trying very hard.
Getting buffed up, yeah. Dr. Ekta Kapoor is a woman's health expert, and now there is more evidence that even among people with normal weight, our body shape indeed matters. It's not uncommon for women as they age and men to gain weight, especially around the middle, and we now know that belly fat is dangerous. It's toxic. But it doesn't have to be, even if you're fighting your genes, like in your family, I guess.
That's right.
As you age, it's important to make better dietary choices and to exercise and become more active, maybe in different ways, like resistance training. Thanks for joining us, Dr. Kapoor.
It's been a pleasure. Thank you.